Hello, everyone, and welcome to our monthly Introduction to Minnesota Paid Leave webinar. My name is Corinne, and I'm on the Public Engagement team with Minnesota Paid Leave, and I'll be facilitating today's webinar. We are thrilled that so many of you can join us today. We have about 225 people here and counting online with us right now. At today's presentation, we'll explain what Minnesota Paid Leave is and how it impacts both employees and employers. We'll talk about who is eligible to take paid leave, the two main types of leave, medical and family, what the responsibilities of employers are, and more. We also have a ton of information on the website, info.paidleave.mn.gov, including FAQ pages for employers and employees. And we'll be posting even more information on the website in coming weeks. I'll also note that the slides to today's webinar are on the website as well. You can find them on the public events page. This webinar will be recorded for training purposes. Should we decide at a later date to make the recording public, a link will be posted on the website and all registrants will be notified. Additionally, we send out monthly email updates about paid leave, which most of you signed up for when you registered for the webinar. But if you didn't, or if you're not sure if you did, you can always sign up on the website. You can find all of the links I just mentioned in the chat. Okay, so today we're joined by Betsy Orn, the Strategic Program Analysis Manager for Paid Leave. We'll start out with a presentation from Betsy, followed by the Q&A session. For the Q&A session, you can submit your questions to us using the chat button. You can find the chat button at the top of your screen. It's the purple speech bubble with a question mark on it. There are two tabs in the chat, the Featured tab and the My Questions tab. Check the Featured tab to see announcements for our team and links we mentioned throughout the presentation. Use the My Questions tab to ask a question at any time during the presentation. Only you and the Paid Leave webinar team can see your question about the program. Other attendees cannot see your question. Our team behind the scenes will be reviewing and moderating the questions for the Q&A session. If you have a question about a unique individual circumstance, or if we don't get to your question, our contact center is ready to help you at any time. My colleague will put the contact information in the chat for the contact center. Okay, that's enough from me. It's time for the presentation. I'll pass it to our presenter, Betsy. Take it away, Betsy.
Awesome. Thanks, Corinne. And hi, everybody. My name is Betsy. I'm so glad to be here today to help you learn a bit about the Minnesota Paid Leave Program. So as we get started with our presentation, I just want to remind us about why paid leave matters. So I am a lifelong Minnesotan. I've lived here most of my life. And one thing I love about this state is it's a place where people really take care of each other. Whether we're helping each other dig out from a snowstorm that might be coming any week now, or bring each other meals when we're sick, Minnesotans really step up and take care of each other. We know Minnesota Paid Leave will support people when they need time to take care of themselves or their loved ones. People will turn to paid leave during some of the biggest moments in their life. They could be really happy moments like the birth of a child, or much more challenging ones like dealing with a serious medical condition. We've been out talking to employers across the state for over a year now, and we know that employers really care about their employees and want to be able to support them during these big moments. And we know Minnesota Paid Leave will help them do that. Paid leave has a lot of benefits to employers. It helps improve employee retention, morale, and performance. And of course, it has a lot of benefits to employees as well, who need that time to take care of themselves and their families. So the bottom line is that Minnesota Paid Leave will help ensure employers can support their employees, and employees don't have to choose between financial stability and being there for their families during these big moments. So what is Minnesota Paid Leave? Let's start by going over some basics. So the Minnesota Paid Leave law was enacted in May 2023, and it was updated in May 2024. And it makes paid family and medical leave coverage available to Minnesota workers starting January 1st, 2026. The law provides both job protections and benefit payments to individuals who take leave for a qualifying condition, such as to bond with a new child or to care for themselves or their loved ones. And Minnesota Paid Leave will be funded by premiums made up of contributions from employees and employers. The premiums go to the state, and the state then sends benefit payments to employees while they're on leave. This is very similar to a medical insurance program. But just as a side note, it's different from something like Earned Sick and Safe Time. Unlike Earned Sick and Safe Time, paid leave payments come from the state, not from employers. And it's worth noting that there's a reduced premium for small businesses, so it'll be less expensive for them to participate. This is really the program on one slide. The program is split into two major buckets. There's medical leave and family leave. Medical leave is exactly what it sounds like. It's leave to care for an individual's own serious healthcare condition. These are events that last 7 days or more. So again, earned sick and safe time might be for more of those day-to-day absences, like if someone needs a day or two off, but this is medical leave for longer term absences. So that's medical leave. Family leave is a little bit broader, and there are 4 types. There's bonding leave, which is leave to welcome a child into your home through birth, adoption, or foster care. There's active duty leave, which is leave when you need to support a family member who's on active duty or has been notified of a call to impending call to duty. There's caring leave, that's leave to care for a loved one with their own serious healthcare condition. And then finally, there's safety leave, which is to support survivors of domestic abuse, sexual assault, or stalking for reasons such as to attend court appointments, seek medical care, or find safe housing. Now, the program offers up to 12 weeks of medical leave or up to 12 weeks of family leave in a single benefit year. And a benefit year starts with the day of first absence, so the day someone is first away from work. In the situations where someone might need both types of leave, they could qualify for up to 20 weeks combined in a benefit year. This could look like 12 weeks of medical leave and 8 weeks of bonding leave. In all of these different scenarios, an individual needs to provide certification that's signed by a healthcare professional or another qualified professional to show that they need this type of leave. So now let's talk a little bit about coverage. So in terms of coverage, the program is very broad. It covers nearly every employer in Minnesota, regardless of size, revenue, or number of employees. And it covers almost all employees, including full-time, part-time, temporary, and most seasonal workers. This slide is really calling attention to specific groups that we get a lot of questions about. So in the green box, this is showing employees that are covered by paid leave. These are listed out as industries because some of them have exceptions under the unemployment insurance program, but they are covered under paid leave. So that includes agricultural workers, religious organizations, businesses with employed family members. So anyone in this green box is covered by paid leave. In the purple box, that's showing employees who are not covered by paid leave, but can opt in. So the law does not cover independent contractors or self-employed individuals, but there is an option for them to opt in. And that process will be live very shortly, and you can go to our website for more information. In the brown and orange box, it shows employees who are not covered by paid leave and cannot opt in. So that includes federal workers or railroad employees, or there's a small exclusion for certain seasonal hospitality employees. All right, because this is a state program, it only covers Minnesota employees. And the law defines Minnesota employee through a localization test. And this test has 2 parts. So first, an employee is localized in Minnesota if they perform 50% or more of their work from a location in Minnesota. So that means anyone who spends a majority of their time working from an office or working from a location in Minnesota, they're covered. So that's many, many employees across the state. Second, for employees who do not work 50% or more of the year in any one state, it comes down to if they live in Minnesota. So an example here might be if someone works a third of their time in Wisconsin, a third of their time in Minnesota, and a third of their time in Hawaii, their work is not localized in any one state. So for those employees, if they live in Minnesota, they are covered under paid leave. If they don't, then they're not covered. So the people that are not considered in this is if you work 50% or more of the time in another state, then you are not localized. So if someone works 50% or more of the time in Wisconsin, they're not covered by the program. This can be very confusing. So we're going to put you all to a bit of a test and just have some scenarios here. So the first example is, I have employees who work mostly in Wisconsin. Are they covered? Think about it. All right, no. So remember, it matters where their work is physically performed. If they perform 50% or more of their work in Wisconsin, the employee is not covered. So even if the employer is based in Minnesota, if the employee works from home in Wisconsin, they're not covered. All right, scenario 2. My business is in North Dakota, but some of the people I hire live in Minnesota. Are they covered? Think about it. All right, depends. So remember, it's about where they physically work. So if they work in North Dakota 50% or more of the time, they're not covered. If they work in Minnesota 50% or more of the time, maybe as a remote employee, then they would be covered. All right, last scenario. I am a traveling salesperson. I work all over across the Midwest. Am I covered? All right. Yeah, again, it depends how much you work in each state. So in that case, if you're working all over many different states and no state more than 50% of the time, then it matters if you live in Minnesota. But if you travel across the Midwest and spend a lot of time, or 50% or more of your time in one other state like Iowa, then you are not covered. Again, if there are more questions on this, this is something that employers will determine first when they set up and submit wage detail, and it'll be something we're asking them to confirm. So this is something for employers. If they have follow-up questions, it would be a great question to call the contact center, especially the UI contact center, as you're filling out your wage detail and reporting for premiums. All right, so at the beginning, I talked about that the program has 2 components. There are benefit payments and job protections. Let's talk about how each of these components work. So starting with benefit payments. So benefit payments are really about helping people get the financial help they need while they're on leave. And that really depends on a person's income. So the lower the income, the higher percentage of wages are replaced, up to 90%. Sorry. The lower the income, the higher percentage of wages that are replaced. At higher incomes, a lower percentage of wages are replaced. So the average employee in Minnesota would have 77% of their wages replaced while they're on leave. The maximum benefit amount is capped at the statewide average, which was $1,423 in 2025. So this means that lower wage workers get more support when they need leave. If you earn less, you'll get a higher percentage of your paycheck. To qualify for paid leave payments, you must have earned at least 5.3% of the statewide average annual wage in the past year. And it's important to note that if you receive other payments like unemployment insurance, workers' compensation, or Social Security disability insurance, you might not be eligible for paid leave, or you might have your payment offset. So it's important that you report those to the division when you apply. This can get a little bit confusing. So we have created a payments calculator on our website. So you can go onto the website and get an estimate of how much you would receive from the state while you're on leave. You can just put in your earnings from the previous calendar year, and you'd be able to see what you'd be eligible for. The other component of the program is job protections. So those work a little bit differently. Job protected leave is really important because it means that it allows employees to take leave and know that when they come back, they will have a job. And this is part of what helps increase employee retention. So the main concept to know is that an employee who goes on leave must be restored to the same position or an equivalent position with the same pay, status, benefits, lengths of service, and seniority as prior to the date of leave. And these job protections kick in 90 days from the date of hire. But it's important to remember that there are other laws that may apply when an employee goes on leave. So an employee may have job protections under the Minnesota Pregnancy and Parental Leave Law or under FMLA. All right, so now we're going to shift and talk a bit about the employer responsibility and what you can do today to get ready for when paid leave goes live. All right, so this talks about some key dates for employers to be aware of. So we launched the equivalent plan application in July, and employers are now able to apply for an employer substitution to offer an equivalent plan that's at least as generous as the state program. You can find a lot more information about this on our website. And again, this process is live and employers can apply today. By December 1st, employers need to notify their employees about paid leave benefits. We'll be talking more about that in a moment. And then in 2026, a lot happens. Employers can start payroll deductions on January 1st. Benefits and leave are available starting then as well. And the first premiums are due April 30th, 2026 to cover that first quarter. Small business assistance will also be available starting January 1st as well. So let's dig a bit deeper into some of these milestones and the different roles of employers in paid leave. So again, it's important that employers, their main roles, there are 4 buckets. So there's reporting wages and submitting premiums to the program, educating and informing their employees about the program, supporting leave administration and coordinating benefits, and helping to support and collaborate to improve the program over time. So let's start by digging into reporting wages. So to determine if someone's eligible for paid leave payments, Minnesota employers need to report wage data for their employees. So the paid leave program has worked from the beginning of when we launched, when we started getting ready for launch over a year ago. We started working with the unemployment insurance program to reduce the administrative burden for employers. That means that for most employers, you can just continue to follow the same process you've been following to submit wage reports through the UI portal, and those become a joint return for paid leave and UI. And that means also that as of February 1st, employers have reported wages for many, many millions of employees, and we're feeling very confident that most employers have already taken this step. If you are an employer who's only discovering now that this is their responsibility, don't panic. You can call the UI Customer Service Center and they will support you to get this ready to go. If you have employees who are not covered by UI but are covered under paid leave, you'll go through and create a paid leave only account. So some employers might have both a joint account and a paid leave only account, and you'll report wages under both of those accounts. And the information there was about the contact center. All right. The next thing that we want employers to be able to do is create a paid leave administrator account. So again, there are the need for 2 different accounts. There's the wage reporting account in the UI system, the joint account, and then a paid leave administrator account through the paid leave website. And this role is really going to help employers to review leave applications, see paid leave determinations, and much more. This will really make it really easy to stay in touch with us during a leave and make sure that you know what needs to happen. If you have not done this already, you want to go into your UI account on the UI portal and identify who should be your paid leave administrator. This is a really important action that employers can take today to be ready for January 1st. We'll put much more information into the chat about how you can find resources on how to do this. But again, go into your UI system and identify who should be your paid leave administrator. All right. So starting in January of 2026, the paid leave program will be funded much like healthcare premiums, split between employee and employer contributions. Because it's an insurance system, again, we want to make sure that it's clear the premium rate will be 0.88% starting in 2026, and that's the 4th lowest of any state paid leave program in terms of cost to employers and employees. The premium rate is applied only on wages up to the Social Security cap that has now been updated to $185,000 in the coming year. And the total premium rate covers both family leave and medical leave. Starting in January, employers will be able to deduct up to 50% of premiums from employee paychecks. We can go to the next slide. So again, no premiums are due today. The first premiums are due April 30th, 2026, but employers can start deducting up to 50% of premiums from employee paychecks on January 1st. Employers can choose to pay more than that for some or all of their employees. The program also offers a reduced premium rate for small employers. For small employers, their premium rate is reduced by 50%, so their total contribution rate is 0.66, and they can still charge employees up to 0.44%. To qualify as a small employer, an employer must have 30 or fewer employees and an average employee wage of 150% or less of the statewide average, which was $107,000 in 2025. And as I said before, that does not change the amount that an employer can deduct from an employee's paycheck, so that can still be 0.44% of wages. All right, so we wanted to talk through some scenarios of what might this look like if you are paying in terms of premiums. So let's say an employer has 50 employees with an average wage of $70,000 and a total annual payroll of $3.5 million. So in this scenario, if they're split in half between the employer and the total workforce, that means that the average comes out across the whole workforce. You can see it. And then across the employee, you'll see that it's less than $6 a week. So again, you can kind of see what that might look like. And you can do this yourself on our website, because we now have a premium calculator as well. So you can go in and supply your business information or your own paycheck information and find out what the premium contribution might look like. All right. I guess we also have a scenario for small employers. So for a small employer, you can see that they have the same, we'll just say they have the same employee wage of $70,000, but only 10 employees. You would see that the premium rate changes for the workforce, but it does not change for the employee. So the employee would still would still pay just under $6 per week, but the amount the employer pays is now reduced in half. So the employer portion is halved because they're a small employer. All right, so as I said before, please check out our website if you have more questions about what your premium calculation might be. Another way that paid leave is working to support small employers is through a small employer assistance program, which is funding earmarked for small businesses. On January 1st, we'll launch this small business assistance grant program. And it's really designed to help offset the costs of hiring temporary workers or paying existing workers who are covering for an employee who's going out on leave, or covering training costs for employees who need to be trained up to cover a role when someone goes on leave. So this grant is for any employer that meets the qualifications of a small employer we talked about on the previous slide and has an employee that goes on leave. Once you do that, this will be a fairly straightforward process to submit and tell us what the additional costs were and to be reimbursed for those costs. This funding could be up to $3,000 for one leave or up to $6,000 total in a year. So stay tuned after January 1st to get much more information about what this process will look like. All right. Now we're going to talk a bit about coordinating benefits while somebody is out on a qualifying leave. So we know that paid leave doesn't exist on its own. It exists with many other programs that sometimes employers might need to think through. And so we'll be continuing to provide more guidance on our website about how these programs coordinate. A few key ideas we wanted to go through today. First, a program allows employers to designate certain benefits as supplemental benefits. So these can be used to make up the difference between partial and full wage replacement. Think of them like topping off an employee's wage. These include sick time, vacation pay, paid time off. And you can think of these as if someone were to get from their state about 2/3 of their regular wage, the employer could choose to allow the employee to use PTO to top off the remaining third so that the employee would get a whole paycheck. So again, in most cases, an employer has the choice to offer these supplemental benefits, and the employee has the choice to accept it. We do want to make the caveat that if a collective bargaining agreement exists, that there may be other components to consider. All right. Any other benefit payments? Sorry, one more thing. Any other benefits that are received during a leave could reduce payments. So if a payment's not designated as a supplemental benefit, it's likely an offset. So for example, if someone decides to take a full sick day in the middle of their leave, instead of taking paid leave benefits, their benefit amount would be offset. So they wouldn't get paid by the state for that day. All right, thanks. Ready for the next slide. So as I mentioned before, one of the key roles for employers is telling their employees about paid leave. It's important that employees know about the program at least 30 days before they start paying into it or before taking leave. So that means that we have a deadline coming up very soon. By December 1st, 2025, employers must begin notifying employees about paid leave. And there's two requirements. First, they must hang a workforce poster in English and in any language spoken by 5 or more employees. These posters are now on our website. They're available in English and in several other languages, and you should go ahead and get that ready today to post on for your workforce. The second major notification requirement for December 1st is for employers to notify each employee individually about the availability of benefits in their native language. So Paid Leave has created a model notification letter, and this is also available on the website today. There are additional languages that will be available very shortly. Our goal date is to have more languages available in the coming week, and that those should be also sent again to any employee who has a native language that is not in English. If a language is not yet on our website, you can reach out to our contact center and let us know. Again, we're working to get more translated. We hope to have up to 30 languages in the coming months. And the requirement under law is that if the translation has not yet been provided, then you're not required to provide it to your employees. So just keep checking our website and please get those notices out as soon as you can. All right. So there are so many different ways that you can stay in touch with us and continue to get the up-to-date information that you need. So again, one way is to watch our website and to make sure that you are seeing those additional updates. Sign up for our newsletter to look for additional updates where we'll share more about webinars, recordings, and those new resources as they become available. This is also where we'll answer questions that we're hearing and provide key updates on implementation. So last, we have a contact center that is live and ready to help you. You can either submit your questions on our website and our team will get back to you, or you can call them. The phone number is 651-556-7777, and you can reach out to them. We have a number of call agents that are ready and eager to answer your questions. And so please go ahead and make those calls if you have specific ones that you think are maybe personal to you today. All right, I'll kick it back to Corinne and we can get into Q&A.
Well, thank you so much, Betsy. Again, today's slides are available on the Paid Leave website right now, info.paidleave.mn.gov. Okay, let's transition over to our Q&A session. Thank you so much to everyone who submitted a question. We have some great questions here. If you'd still like to submit a question, please do so. You can find the chat button at the top of the screen. It's the purple speech bubble with the question mark on it. This is a reminder, only you and the webinar team can see your question. Like I said, all of your questions are really important to us and we'll address as many as we can, but there are a lot of questions and there's only about a half an hour left. So if we can't get to your question, please know that our contact center is ready to help you now. And we'll put the link in the chat as well. Okay, I'll start with a few common questions that we often get because a lot of folks in the call are likely to have the same questions about the same topics. And then we'll take some questions from the audience. Okay, Betsy, what happens if you have a baby in 2025 before paid leave goes into effect in January?
Yeah, great question. I know a lot of people on the call are likely wondering about this. So a person is eligible to take bonding leave within 12 months of welcoming a new child into their home through birth, adoption, or foster care. So that means, say someone gave birth in October of 2025, they would be eligible to take bonding leave in 2026 as long as they complete the leave before the child's first birthday. Okay, and each parent is eligible for up to 12 weeks of bonding leave. So there might be a scenario where both parents are eligible for bonding leave in 2026.
That's great. Betsy, can employers opt out or choose not to participate in paid leave?
So there's no way, employers cannot opt out of paid leave. They can choose to offer an equivalent plan instead of participating in the SAPE program. So they can apply for an equivalent plan that meets or exceeds coverage offered by the state. Employers that are approved for an equivalent plan will not pay premiums to the state, but they will have other obligations under the law. They still need to submit wage detail reports to the state each quarter and comply with the notification requirements that we just talked about. So there's a special notification letter model notification letter that's on our website now for employers with equivalent plans. So they should follow that process and make sure that they're getting those notices to their employees.
Will an employer's premium rate increase if employees use paid leave?
We get this question a lot because unemployment insurance has sort of an adjustable rate. But under paid leave, the amount of usage does not change the rate. It's a flat rate. So no, the rate will not change. The rate will be flat for all employers. It's 0.88 unless you're a small employer for 2026.
Okay, how will paid leave work with PTO, paid time off, or sick time or vacation time?
So employees can choose to take PTO, sick, or vacation time instead of paid leave. So if they choose to do that, their benefit amount will be prorated for those days. So if you wanted to use PTO for the first 2 weeks and get full pay, you're allowed to do that. But again, the paid leave program will then prorate and not pay the person for those days. The other option is that PTO could be designated as a supplemental benefit by employers, in which case PTO can be used to supplement or top off the benefit while they're on leave. And in that case, again, you could use a partial day to help bring you whole and to make sure that they're getting their full wages during the leave.
Okay, another question we often get is about short-term disability. How will paid leave work with short-term disability plans?
Yeah, so in states that have implemented paid leave before, we've seen a lot of changes to the marketplace for insurance plans. So typically insurance companies either start offering an equivalent plan option that meets or exceeds the state program, or they offer supplemental short-term disability programs that make up the difference between paid leave and an employee's typical salary. If an employer continues to carry one of those supplemental short-term disability programs, paid leave will be the first payer, and then short-term disability is the second payer. So for example, if paid leave replaces someone's wages at 66%, the short-term disability policy could then pay that additional amount, so up to 33%.
Great. Do employees have to notify their employer about their intention to take leave, and when?
Yes. So employees are required to notify their employers up to 30 days before their leave or as soon as they can in the event the leave is unplanned. So when employees apply to paid leave, they'll be asked if they've notified their employers, and they'll be required to let us know the date and the method that they use to notify their employer. Their employer will also then get notified about this. So you want to make sure that the first thing you do when you're thinking about taking paid leave is have a conversation with your employer. Make sure that they're aware of the plan so that you can be on the same page. That's what will make this go the smoothest. So again, we're encouraging you to tell your employer as soon as possible.
Thanks. And you mentioned that an employee can take 12 weeks of each type of leave, up to 20 in a year, in a benefit year. What counts as a benefit year?
Yeah, so under the Minnesota paid leave law, a benefit year starts the first day someone is absent under the statute, so the first day of leave. And so this means that that's the day that their wage replacement rate will be calculated for the year. It's also when their leave allotment begins, so it's when they can start taking those 12 weeks, and then it will reset 1 year from that date.
A big question we often get are S Corp owners covered by the paid leave law?
Yeah, we get this question a lot. So there's no explicit exclusion for S Corp owners under the paid leave law. So that means that any S Corp owners who are wage-taking shareholders are considered employees of the S Corp. So that means that S Corp should set up a paid leave only account for those employees through the UI website and report their shareholders reasonable wages from their W-2s.
And how long after applying with the state can an employee expect to learn if their application for leave was approved or denied?
Yeah, great question. And again, I'll emphasize that the fastest way to get approved is to come in and be on the same page with your employer. With that said, our goal is that for deciding claims is 2 weeks from application. So we hope to have decisions out before then.
2 weeks, that's great. Okay, so can an employer make up the difference between partial and full wage replacement for an employee when they're out on leave?
Yeah, so as I talked about before, employers will be able to designate certain paid benefits like paid time off, vacation, or sick time as supplemental benefits. And that allows employees to choose to receive up to their full salary during their leave. That decision to offer supplemental benefits is up to the employer, and the decision to utilize them is up to the employee. Again, with the caveat of where collective bargaining agreements exist, there may be other terms to consider.
Great. Well, thank you, Betsy, for answering those common questions. We're going to transition over to questions from today's audience. Again, thanks so much to everyone who submitted a question. If you'd still like to submit a question, please do so. You can find the chat button at the top of the screen. So we'll go ahead with our first question. When can employees begin applying? And if an employee had a baby in March of 2025, can she apply now?
Yeah, so our program goes live January 1st, 2026. So our program application will go live in January as well. We are encouraging people to stay tuned and join, get on our newsletter for additional information about any opportunities to participate or to test out the program prior to that date.
Great. This question is on the reduced premium for small employers. When will we receive a letter letting us know if we are at the 0.66 rate for small employers or the standard 0.88% premium?
Yeah, great question. That is something that we are working with the Unemployment Insurance Division to get sent out very shortly. So the goal is for that to come out in the next couple of weeks so that you'll have that information for those notification purposes. We'd also encourage you to check in your UI account, as that is, the letters will be mailed, but they also should be posted in your UI account before that date. So then you wouldn't have to wait for the mailing.
Great. So you answered the question about S Corps earlier. This is another question from a small business owner. I own an LLC and draw a salary from that company. Would I be required to pay into paid leave? And if so, can I draw from paid leave to take care of my parents who are ill or for bonding time?
So again, the question here is, are you self-employed? So if you own, again, I know there's many different tax statuses, and we actually have some additional guidance on our website to help you understand if you qualify as self-employed or not. But if you are self-employed and you take a Schedule C, then you would be not covered by the program, but you would have an option to opt in. So the option to opt in is something that is going live, and there's more information on our website. It's going live in the next couple of weeks. So you can go on and see what that process looks like. In that case, you'd be reporting your earnings over the whole previous year, and you'd be paying a premium on that amount and then be eligible to take leave from the state. So again, it's kind of like opting into insurance coverage. If you do not use a Schedule C and say you get a W-2, in most cases, that means that you're not self-employed and that you are an employee. So that tax status and how you're structured is really important. And we do have additional information on our website that we'd encourage you to check out and see, depending on your structure, whether or not you meet the definition of self-employed.
That's great. So if they're a W-2 employee of the business, they can take time off to care for parents who are ill or for bonding time.
Generally, that's true. Again, I would say I would check and make sure that that's aligned with this tax structure that you're under. Because if you might get two forms, then I think that's something you'd want to check with your tax professional of how am I structured? Am I technically self-employed, or am I technically more of that S Corp status where I get a W-2 and I'm a wage taking earner?
Great. Okay, so we have a couple questions here on intermittent leave. Are there any restrictions on intermittent bonding leave? Or can the employee say they need 2.5 days off a week, or they want to work half days, or just every other Wednesday? Do employers have to accommodate, even if that's a hardship for the business?
Yeah, so let me talk a bit about what intermittent leave is, since we haven't gotten there, to make sure I'm setting a baseline. So under our statute, people can either take leave continuously, all in one big chunk, or intermittently in smaller chunks. And in the situation where someone needs to take leave intermittently, it can either be on a set schedule where they know in advance they're going to take leave at certain dates, or it can be more for episodic issues where it might be like flare-ups of a medical condition where they need to take leave at certain times. So both of those are allowed under our statute. Under our statute, when someone is taking intermittent leave, they do need to provide the leave schedule to their employer. And there's the opportunity for an employee to have that conversation, the employer to have that conversation with them about what would minimize their disruptions to the employer, to the employer, right, to the business, to the organization. So we encourage, again, people to have conversations about what's going to work in their context. There is also a process that if the employee did not provide their leave schedule in advance, an employer can let us know through a dispute process when they are showing us the leave has been submitted. There is no process, though, where an employer can reject someone's leave schedule. So an employer, at the end of the day, if the employee cannot make changes to their schedule, the employer needs to accommodate what their schedule is. And that provision does apply to bonding leave as well. So yes, employees have a choice to take bonding leave intermittently, and they could propose different leave schedules. We think that it is appropriate and under the statute to have that conversation, but we'd encourage people to be mindful that they're not going into the territory of retaliation or interference, which is, again, not allowed under the statute.
Another related question to intermittent leave is how many hours are employees eligible for under intermittent leave? Is it 480 hours, or is there a different threshold for intermittent leave?
So intermittent leave really depends on someone's schedule. So in most cases, someone, again, is eligible for up to 12 weeks of intermittent leave, of medical leave or family leave under the law. So if somebody works, it depends on how many hours a week. If they work 20 hours a week, that's 20 times 12 would be the number of possible hours of intermittent leave. If they work 60 hours a week, it's 60 times 12. Our law has a limit where an employer can say over 480 hours, they can choose that an employee can either continue to take the leave continuously intermittently, or they need to take the rest of their leave intermittently. So there's not like a hard and fast stop. There's just a chance for employers to say over that amount, they want the employee to then take the rest of their leave continuously.
Okay, that's great. Thank you. Who is considered a family member for carrying leave? Is it the same thing as earned sick and safe time?
Yeah, so under our law, there's a broad definition of family, and it's very similar to under the earned sick and safe time law. So it includes, most blood relatives. It also includes those by marriage or by step siblings. So you can see that on our website. I'm sure someone could put it in the chat for me. And it also includes anyone who has a reliance on you to care for you, even if they're not related by marriage or blood, as long as it's an unpaid role. So someone who, again, you rely on. So it could be a neighbor in the situation if you are the person who is relied on to care for that person, and there's not somebody else who could step in or take that leave. This will need to be part of the certification process for carrying leave. So in the carrying leave, there's an attestation about this relationship, and there's also the need to provide for the medical professional to be part of that certification and to say the person who needs care from this person. And so they would need to seek out certification from the medical professional of the person needing care.
Okay, this next question is about the application itself. When an employee submits an application for leave, are they able to do that with a smartphone or an app, or do they need to do it on a computer?
Great question. Yeah, so our application is mobile friendly and meant to be done in a way where you could either access it from your phone or from a computer. So you don't need a special app, but you can do this on your phone. You will need to use, one option it gives you is to create sort of an authenticator piece where you might need to use your phone anyway to make sure that you can do that first step of identity verification. If you can't do that and you're doing it on your computer, you can upload documents to show that you are who you say you are.
Great. Okay, does an employer need to start payroll deductions at the date of hire or after the 90 days that they're eligible? Do they start right away once they're hired, or does the employer wait to deduct the premium?
Good question. No, the premiums can be deducted from the day of first hire. So again, and somebody could take leave before then and receive benefit payments. Their job just might not be protected.
Okay, so someone could be eligible for wage payments, but not job protections, or the other way around.
Exactly.
Okay, when using the payments calculator on the paid leave website to estimate what my weekly paid leave payments would be, should I put in my gross earnings?
Yeah, put in your gross earnings, and then when you take paid leave, that would be your gross amount. And then if you decide to have taxes deducted, that amount might be lower when you actually get your check.
Thanks. Now, this next question is on the small business premium discount. Is the employee count for the small employer premium the number of Minnesota employees or the total employee count at the multi-state employer? So if an employer has 30 or fewer in Minnesota, but 4 employees countrywide, how does that work?
So the data we have for this question really comes from wage reporting. So we're relying on the joint UI paid leave wage reports. So it's about the number of employees that are covered under the paid leave law and that are reported through that system. So if an employer has fewer than 30 employees reported to the Minnesota paid leave system, then they would qualify. Again, there might be scenarios where someone has employees out of state. Those do not count towards their overall count.
Okay, this next question is on the localization test. This is for employees or employers who have employees both in Minnesota and North Dakota who work across the border. How do we determine whether to deduct the payroll tax? We don't know which state the employee will work in most of the time until the end of the quarter.
Yeah, so this can be a little bit confusing, and we encourage you, if you have specific scenarios, you can reach out to unemployment insurance to get some follow-ups. But in general, when you are making this decision starting in January or in April for the first quarter, what you're going to want to think about is our law is about for the year. So are you anticipating that this employee is going to, for the 2026, be working in a location in Minnesota most of the time or in North Dakota most of the time? And we're asking employers to make their best assumptions about that. So say, yes, I think they're probably going to work in Minnesota most of the time. You would begin payroll deductions, and then coming in April, you would submit that quarterly wage report. If at the end of 2 quarters you found out that, or 3 quarters, you found out that something was wrong and that was not true, you could amend your wage detail. And you can do that by calling the UI contact center and making a change. Again, we think in most cases, most people will have that sense, but we know there are some specific scenarios where it could change. And so there is a process for that.
Great. Okay, going back to the small business premium rates, our number of employees is over 30 sometimes and under 30 other times of the year. How does that affect the small business or small employer premium rate?
Yeah, so the law requires that it is anytime they have to have 30 or fewer for the whole year. So that means that if you ever have more than 30 employees, unfortunately, you would not qualify for the small employer premium rate. So it will be looking back over the past year and making that determination. And that's something in statute. So again, that's something that the program itself cannot change.
Betsy, you mentioned that employers cannot opt out of the paid leave program. Can employees opt out of the benefit?
So under our program, again, because it's a social insurance program meant to cover everyone in the state or as many employees as possible in the times when they most need help, there's no opt-out process. So again, folks will be covered who are employed under covered employment. And so there isn't really a process to opt out. There's just a process for employers to offer an equivalent plan.
Great. The next question is about supplemental payments. If an employer elects not to allow supplemental payments, does that limit the employee from using earned sick and safe time during their leave as well? Or is earned sick and safe time not considered a supplemental payment?
So earned sick and safe time would only be considered a supplemental payment if it is designated as such. So again, a supplemental payment, again, you can designate sick time or earned sick and safe time as a supplemental payment, but if it is not designated that way, then it's just kind of considered sick leave. And so in those scenarios, again, an employee has the choice to use sick leave, PTO, or vacation leave in lieu of or instead of their paid leave benefit.
And will that reduce the amount of their leave allotment if they do use earned sick and safe time or PTO and vacation instead of?
Yeah, so if it's part of the leave period and they're taking days instead of, again, they could apply and let us know, yep, I'm taking the first week and I'd be using my sick leave. And that time would be part of, they'd be counted towards their weeks of paid leave, but the division would not pay them for those weeks. So if you're getting paid from your employer for that time, then the state would not pay a benefit.
Okay, we have a question from an employer with a private plan who decided not to go with the state's plan. Does it mean that we are still required to have employees not pay more than 50% of the premium?
So the requirement under the law is that the equivalent plan cannot cost more to the employee than the state plan would. So what that means is that an employer with a private plan cannot charge more than 0.44% of wages under their state plan, under their private plan. So if their plan costs 1.1% of wages, they can still only charge employees 0.44% of wages because of that requirement.
Is the premium based only on wages and tips or the total amount paid? They're wondering about monthly stipends that help cover cell phone bills or other stipends or bonuses at the end of the year.
Yeah, so the wages are based on the definition of wages under our statute, and that's the same definition that's used for unemployment. So if there's a specific question, in general, it includes, again, cash wages, commodity wages, it includes like anything that would be reported on a W-2. It also includes things like housing stipends. If there's more specific questions, I'd encourage you to either check the definition of wages on our website or reach out to the contact center to get a full list of those sort of like more specific things. But the general rule is, again, if you've been reporting it for unemployment, that counts also for our statute as wages, and you'd need to pay premiums on that amount.
Great. We have a couple questions here about the notices to employees by December 1st. You mentioned that you have to hang a workplace poster and provide an individual notice to all employees by December 1st. The question is, do employers need to provide an individual notice to all new hire employees? If so, how long do we have to provide the new hire with the notice? And
yeah, so go ahead.
Go ahead. Answer that one first. Sorry.
Yeah, so again, for all existing employees, the notice requirement is December 1st, because that's 30 days before any premium collection begins or before anyone could take leave under the program. So that's why that's so important. But after that date, if you have a new hire that starts sometime in December, or you have a new hire that starts sometime in the new year, you need to provide that within 30 days of hire. You need to give them that notice. So probably easiest to do it right away.
In the new employee handbook.
Yep.
When will the required posters and notices be available in all languages?
So we're working on getting those up right now. And so as I've said, we have workforce posters in multiple languages already on the website. And there are, I heard today that the notification templates, the letters, should be available in kind of the main, the most common languages, so Spanish, Hmong, and Somali, as soon as next week. So again, we're working really hard to get those ready. And then we're continuing to add more as we can get them translated. So I just want to emphasize again, check the website, make sure you're getting those out to people as soon as possible. If December 1st comes and there's a language that is not yet available, that requirement is it's tied to the department, the state actually creating that. So don't stress if you have a very rare language that's not up. Just as soon as we do post it, try to get those notifications out to your employees and those posters up as well.
That's also a great reason to sign up for our newsletter. We will be sending out a notice that we have the notices and the posters in multiple languages as soon as it's available. We have 5 minutes left, so about time for 2 more questions. Betsy, how do employees pay their health insurance premiums while on leave?
Yeah, this is a great question. So to make sure I'm reemphasizing, another part of the statute requires that for an employee that's on leave, the employer must maintain group insurance policies that they were on before they went on leave. So if you're covering an employee's medical insurance or dental insurance, you need to continue to cover the employer portion, and employees should continue to cover their portion. Now, there's a few ways we've heard employers are thinking of dealing with this. I think the easiest is in scenarios where the employer chooses to offer supplemental payments. If they offer some amount of either PTO or wage replacement during that leave, then they can also still deduct those amounts. So that's one of the smoothest things we've heard. The other options is that you could have, if it's a planned leave, you could have the employee pay it in advance, or you could invoice the employee while they're on leave, or have them make up and pay the amount when they come back. They could pay double payments, double deductions, or something like that. So I think there's a variety of different ways that employers can collect that amount while someone's on leave.
Great. And so the final question here is, can you talk about what steps paid leave is taking to prevent fraud?
Definitely. So we know fraud is something that's on the minds of many people across the state, and the paid leave program is committed to making sure that benefit payments go to the employees who so much need them to take care of themselves or their loved ones when they have a leave. And so we are doing a variety of things to make sure that we are staying in front of any of the organized fraud that we know is out there that's trying to hurt programs like paid leave. So we have a very, very strong fraud team where we've pulled in national and state experts on fraud who are building very strong systems to be able to anticipate and address any of these issues. We're also learning from other paid leave states to understand what patterns we need to anticipate and we need to address. And we have a variety of controls in place at all levels. So some of them that we can't tell you about because sometimes the best controls are those that are happening behind the scenes. But we will say some of those things you will see when you apply and participate with the program. So when someone applies for paid leave, they'll first need to verify their identity. And there's several ways that they can do this, but they'll need to there's a process where you'll either take a selfie of yourself to make sure you are who you say you are, and again, provide documents to help us know that you are who you say you are. We also are going to be verifying through the certification process. So making sure that you are getting certified through a medical provider or another qualified person that will be verifying is who they say they are. And then the last step, and again, we encourage employers here, that employers are a key part of this as well. Employers will get notified about every leave application and will have an opportunity to review to make sure that information looks correct. And again, you can always flag for us if you have any concerns. So we think all of those things that are going to be visible and the invisible supports are going to make sure that we have a very strong program that is going to make sure benefit payments get to the people that need them.
Well, thank you, Betsy, and thank you everyone who joined us today. It is 1 o'clock and we want to be respectful of everyone's time. So hope you have a great afternoon and thank you for joining us.